Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. You're probably looking at this patient's hand wondering, what is that? Future dermatologists out there know what this is, right? It's very red, rotund. It's a pyogenic granuloma. Note that they often occur on the digits. We're going to be talking about this and much more. This is Vascular Tumors Pathology. We cover this in your book, Medical School Pathology and Step 1 Review. It has everything in it that you need to succeed in medical school pathology and importantly on the Step 1. So use it. Now, vascular tumors. Well, what are vascular tumors? Vascular tumors are abnormal growths of vascular tissue, like we see on this pyogenic granuloma on the thumb. Key vascular tumors for your level include hemangioma, angiosarcoma, and Kaposi Sarcoma. Those are the three that you must know. So we're going to talk a bit about vascular tumors. This is just a histologic representation of a Kaposiform hemangoendothelioma, just to iterate that there are many different types of vascular tumors. There are many different types, but there are three key ones that you specifically need to know about, and we're going to talk about those in detail. Starting with hemangioma. Now, a hemangioma is a benign tumor made up of blood vessels. They often affect kids, right? Like in this image, we have a small hemangioma on the scalp of a 2-year-old female. Note its appearance. Hemangioma. Hemangiomas often present on newborns at birth and often degenerates during childhood. Hemangiomas most commonly affect the skin and liver, although they may affect other organs. Here's a histologic representation of a cavernous hemangioma. Note the dilated vessels, and the accumulation of red blood cells in the spaces. And keep in mind, this is something that a lot of you future pediatricians are going to see, as well as family medicine or even internal medicine. Hemangiomas, while they may look somewhat scary clinically, they're not malignant for the most part. We can handle them, okay? For example, here's a juvenile hemangioma, aka infantile hemangioma. Now you can understand why, future pediatrician, that mama and papa would want to know what's going on with their young child, right? With these protuberant growths. This is when you get to be a hero. You get to tell them, family, it's okay. I know this appears to be worrisome, but fortunately your baby's going to be all right. These often will resolve on their own. Now, if they're causing issues with either breathing or eating or something like that, I could talk to my surgeon friends, set up an appointment so that they can surgically excise and treat this condition, right? But for the most part, they resolve on themselves and involute and go away, despite their anomalous presentation. Now, we said hemangiomas can occur on the skin and various other organs, most notably the liver. Here we have imaging of a hemangioma of the liver, seen here on ultrasound. Now let's move on to a malignant vascular issue, angiosarcoma. Now this one we need to be worried about from a clinical standpoint. An angiosarcoma is a malignant proliferation of vascular endothelial cells that is extremely aggressive. Common sites that angiosarcomas may occur include the skin, the breast, and the liver. And note that angiosarcomas stain positive for CD31, particularly in this cutaneous angiosarcoma. Now, what's a risk factor for angiosarcoma? Well, exposure to thorotrast, which is a suspension of radioactive thorium dioxide particles, as well as polyvinyl chloride and arsenic. Those have all been linked to liver angiosarcoma. And side note, breast implants have been associated with angiosarcomas. So if you have a patient, future plastic surgeon out there, if you have a patient who's complaining of a lump or some sort of lesions with their breasts, have angiosarcoma on your differential. Now, we know that exposure to radiation to breast cancer can increase the risk of other cancers, right? One of those cancers is angiosarcoma, and that's usually about 10 years after the radiation treatment. So future radiation oncologists out there, keep this in your back pocket. Here we have a histologic section from a patient with angiosarcoma. Note the vessels and the blood and the basophilic background hinting at multiple high cellularity issues. And here we have CD31 staining from a primary angiosarcoma of the ovary. And again, another example of histopathology for an angiosarcoma. Note the centrally located high-grade angiosarcoma. You see those mitotic figures, especially near the middle? You see the increased cellularity? You see the vessels forming? Angiosarcoma. Now let's move on to another highly tested condition, Kaposi Sarcoma. Kaposi Sarcoma is a low-grade malignant proliferation of endothelial cells. You're going to see this a lot because it has classical skin findings, as you can see here in this image. Kaposi Sarcoma is associated with various infections, viral infections, two of which you must know because you will be asked. And those are human herpes virus 8 or HHV-8, as well as HIV infections. And like we saw, Kaposi Sarcoma presents as purple plaques, nodules, and patches on the skin. Visceral organs may also be affected in Kaposi Sarcoma. And Kaposi Sarcoma is classically seen in HIV/AIDS patients, immunocompromised individuals, transplant recipients, right, because they need to be immunosuppressed, i.e. immunocompromised to a degree, as well as, for some reason, older Eastern European males. And with that, another very high yield, short presentation is complete. Congrats to you. You're going to do great. Keep studying. Make sure you're reading your book. If you have any questions, comments, or concerns, let me know, right? I'm here to support you, and I want to see you succeed. So keep studying, and I'll see you later.